And now it's Deborah Kobylt Live.
Hi, everybody, and thank you so much for joining us today on my show, Deborah Kobylt Live. And we're here speaking with Dr. Paul Corona. His latest book that he wrote, The Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide. 30 years in the making. Doctor, thanks for joining us. And I will say the title of that book is quite a mouthful. Can you explain to us what's behind this book and why did you write it?
Well, thank you, Deborah, for having me on. I really appreciate it. Well, this book is something I've been working on off and on for about 5 years now. I wanted to make it, this is technically my sixth book. I have three out already, but I have two more coming. But this book I wanted to make different because this book is really about storytelling. I wanted to write some fiction. I'm a fiction fan. That's my favorite reading. So I wanted to write a book about telling stories about people, because in my practice is every patient I see is a story, their own story. And so I write 30 original short stories in this book, varying from the more common things I see, like anxiety disorders and depression and bipolar disorder and ADD. So that's the first section. And then I move into more complex things like PTSD and eating disorders. And I talk about personality disorders like narcissism, sociopaths and psychopaths. And then I move into the section of the book where I talk about the subjects of the subtitle, addiction and homelessness and suicide and things like that. So what I do in the book is I talk about a subject briefly. I refer a lot to my first three books because what I say is if you want to do more reading on this subject, go back to book one or book two. So I refer to my first three books a lot because really more I want in this book is more of the stories, not the descriptions. So I really happy how it came out, and then in the fifth and sixth sections of the book, I tell my own personal story. And I share good thing. I share tough times I've gone through, struggles and triumphs. And so it's a very personal book. It's a book I really enjoyed writing, even though it was a lot of work. and writing is a lot of work in general, but it's a book I'm really proud of. And it's a book it's done really well. I've sold well over 1,000 already, but I lost track now.
Let me ask you, you touched upon your own life. Can you briefly tell our audience about you and your story?
Well, basically my story starts back when I decided during training days, I didn't really know what I wanted to do in my medical school days. And I liked different things like pediatrics. I liked OBGYN. So I didn't know exactly what I wanted to do. So I chose family medicine as my specialty to train in. And then I did a 3-year residency training program in family practice. Because I thought this was a way I could see a variety of things, and I enjoyed it. That includes mental health training, psychiatry, but and when you're a family doctor, that's not a big part of your practice. Mm-hmm. So during the 1990s, I started really getting a feel for and understanding treatment of depression and anxiety. And then new medications started coming out in the 90s. And I just got so fascinated by what I was seeing. And I was really understanding it. And I was really getting good at treating it. So after early in 2000, 2001 and 2 is when I had to make a big decision. And I decided to give up on family medicine. And I decided to move into doing this full time. So my story is very unique, being a family doctor originally, and then now doing psychiatry full time. I don't know another doctor that's done that. But I think it gave me a unique perspective that I think most doctors don't have, which is the fact that I really understood the physical component of mood. And so, for example, stress causing headaches and neck and back pain and stomach problems and IBS and fibromyalgia. So I started seeing this link between the mind and body. And I started to see, and that's what really fascinated me. And I think were I not a family doctor originally, I may not have really picked up on that. I think I think psychiatrists miss that, and I think that's why they prescribe how they prescribe, because they don't really understand the physical part of the body. Whereas primary care doctors don't do a lot of this, so they don't really understand the brain part. They understand the body part. So what I did is kind of tied both together, which is what started me in 2002 writing my first book, Healing the Mind and Body.
Mm-hmm. I also really appreciate the personal stories with each chapter, because it makes us feel like we're not alone, regardless of what's going on, what chapter we're reading, right? It's like, oh, okay, Katie went through this too. Or Bruce went through this too. There's a way to get through this. Bruce actually touched my heart a little bit. I believe that he struggled from PTSD. You talk about him. We'll get to that in a moment. Let's talk about what seems to be ailing much of the public these days: anxiety, depression. I often wonder, is it because we're talking about it all the time? It's something that, I know growing up, it's like you're having a bad day. It's like, go outside and play, be quiet. I'm not saying that's necessarily the way to handle it, please. But I'm saying I notice that everyone is talking about their ailments. Is it almost too much, doctor?
Well, I think it's just being recognized. I think it's not something that just popped up this generation. I think it's been going on since time began.
Hmm.
And I think like previous generations, people see, when I take family history, then people say, oh, I don't think there's any family history, but oh, my grandpa was a pretty bad alcoholic, and my grandma was a very nervous lady, so when you try to get a history from people, they go back and it describes like, yeah, I think maybe I got this from my grandpa or grandma or mom or dad or sibling or whatever. So I think it's something that's been around forever. It's just that we're talking about it more because now we have more. We actually have treatment options, and I think also this generation, and we talk about things more. We talk about our feelings more. It's not like in the past where they just bottled up their emotions and didn't talk about personal things. Now we all want to talk about ourselves and how we feel, and we should. But I think back in the day, we didn't really have any treatment or many good treatments for these things. So there's really not a lot they could do back then. The modern antidepressants really didn't come out until the like early 1992, 90s, late 80s. And so before that, really, they had very crude medications that had a lot of side effects. And so really, we've only had about 30 years or so, and maybe a little more than that, of actually modern treatments for these things. And so I think that's why I don't think it's necessarily that it's happening more. Maybe more because there's a lot of stressors going on in our world, in our country, and so maybe because of what's going on, that's heightening it. And COVID didn't help the situation for sure. But yeah, that's I think, like I said, it's something that is extremely important, because I think if people bottle it up and not talk about it, it just festers and gets worse.
Do you believe much of anxiety? Well, let's say depression. Do you believe that it's something more genetic or just a combination of? Because as you mentioned, our lifestyle is complicated. It's getting busier and busier, certainly in this country. You visit a lot of other countries, they don't necessarily live at the rapid pace that we do, in which case, I just came back from Italy for the second time in 2 months because I was there working recently. And I thought, my goodness, they do live differently. Their foods are different. In fact, certain ingredients are actually outlawed in that country. You can't even cook with it. And they do take the time to be together as a family, or at least as a community. And I know that a lot of that has gone out the window in this country. It really has. And of course we're stressed. I'm stressed, right? It's like my kids are across the country. I'm trying to pull people together. I'm like, oh my God. And then it doesn't happen and I get depressed. So it's like the chicken and egg effect. Are we born this way, or do you think it's more what our society has created?
It's a combination. I talked to a patient yesterday who moved down to the South, like Tennessee, and he said, "Oh my gosh, it's so much more relaxing down here. The people are nicer. the pace of life's a little bit slower. People actually visit. They actually want to talk to you. They know each other. So I think it's that, part is our busy life, but I think the number one cause of these problems is genetics, so, by far.
Mm.
So someone might have the best life. Everything's great. Finances are wonderful. No worries, no stressors. So why am I depressed or why am I so anxious? I don't have any reason to be. So people are always looking for reasons to feel a certain way. Some of the people successful people in Hollywood are rich and successful, and their fans adore them, and we're like, what do they have to be depressed about? I mean, come on.
Mm.
Why would Robin Williams kill himself? Why would Twitch kill himself? Why? So it doesn't make sense. Well, so genetics is number one. It runs in families, and so that's why I take a really good family history from all my patients, because that's how you can pick out a lot of things. Number two is hormonal changes.
Mm.
So women get a little bit worse than we do when it comes to this. So that you got puberty for boys and girls. So that's why a lot of these things happen: depression, anxiety, starting in middle school. Late elementary school, middle school, early high school. That's a very common time it starts. Then we got premenstrual. Then women experience maybe the week for their period that they have a bad week. Then afterwards they have a better week. So there's that part. And then we got postpartum after childbirth. It can cause depression. Then we got perimenopause, menopause, postmenopause. So that menopausal time frame when estrogen drops down and the hormones change, that can bring it on. So that's number two. Number three is stressors. So sometimes, like in Bruce's case, situational stressors, like in his case, the Vietnam War and PTSD. So then there's also of course, the stressors. So people who are victims of crime, people who are going through divorce, people who are moving, they lost their job, so there's obviously situational stressors definitely play a role. So the perfect storm is when someone has all three things coming together at one time. But those are the main causes.
PTSD. I mean, what about a kid who, tries to navigate his or her way through their lives, but their upbringing was really tough, and then all of a sudden they're adults now, and they're trying to navigate through adulthood, and they just can't. How do you help with someone in terms of therapy get through that? That's a big question. It's a loaded question, but if there is any sort of answer that would sort of appeal to all of us, what would that be?
You mean you said for kids?
Well, a kid who went through a tough time in childhood, and then they're trying to, they maybe bury it or just say, I got to get on. Now they're adults, and all of a sudden they're realizing they're struggling with all kinds of stuff, work, they're struggling with relationships. How do you help treat somebody with PTSD? Do you go back into the past? I mean, it's a complicated question, but
Yeah. But basically, these are people who also need therapy. I mean, my specialty is medications, and medications play a huge role. Even when people say, "Well, it was the circumstances that causing this," how are medications going to help? Well, medications help because there's often a chemical component to this. Even so, I have a lot of patients who've been to counseling for years and years and years and years, and they do better. But then they see me one or two times, and all of a sudden they just do way better. And like, oh my gosh, I didn't realize that. Yeah, well, I mean, what that means is that the therapy's helped, but that you needed another step. So I think with a lot of these people too, though, therapy is needed. In the case of PTSD, there's a specialized therapy called EMDR, which is a kind of therapy that's just really focuses on trauma. And it's highly successful. So certain types of therapy are more successful with that. But PTSD is extremely common. It's not just people from the wars. It's also people, like you said, with bad upbringings. There's sexual abuse is common, physical abuse, emotional abuse. So I see a lot of people in their teen years, in their 20s and 30s, who had really bad childhood situations, and they have a hard time getting over it. And so in those people, I definitely recommend therapy.
I was just on a plane to Italy, and there was a good deal of turbulence. I'm not fond of turbulence. and I was grabbing anybody who was near me, and was a little vocal about it. I had a lovely young lady that was next to me. I actually felt so badly I was putting this on her, my anxiety. And the woman in front of me said, she turned around, buckled in, and she said, you need to practice EMDR. Do you know what that is? And I said, I do. But at the moment, it's not going to work. I mean, I just went right through it, and I didn't listen to her. And everybody else was calm around me. And I could have used that moment to practice something like that. But the child in me was saying, to heck with it. Just keep panicking. Do you know what I mean? It was one of those moments. What do you do to get through a moment like that when you know that there's other ways to cope, but you won't even let yourself do it? You know what I mean?
Well, flying is a very common phobia. Public speaking is up there, but flying is up there. And then, what do you do? I mean, if you can learn like meditation, breathing exercises, sometimes learning how to meditate and like yoga kind of breathing, and that can help. If you have Xanax around, that doesn't hurt.
I could have used it. Honestly, I could have used it because nothing. I was trying to calm myself down. And it was in one of those moments where the more I tried to calm myself down, the more pissed off I was getting at my situation. And it just kept escalating. You know what I mean? So, maybe a pill would have helped me. There's no doubt about it. And I have to fly soon again. So maybe I'll just grab something and take it with me because I'm with you there. In which case, I'm not a big medicine person, but I'm starting, to your point, why not take something to calm you down a little bit? Take off the edge, right?
Yeah, I mean, some of my patients say they're going to be doing some flying. So I give them like a handful of them, take with them. They say I don't really use them for anything except for like when I'm flying and I'm afraid. So they take it, and some people, because when you hit turbulence, it might be a little too late because it's not going to kick in seconds or
right.
within a minute. So sometimes people take a little bit when they get on the plane, and if it's a long flight, they take a little bit more 4 hours later, and if it's, so they just kind of take a little bit throughout the flight, and that can help. But that's just a temporary fix. But since that's a perfect example of that's a situational stressor. That's causing that.
Right.
Another one I failed to mention is something like flying or getting in front of a crowd, and you're not used to speaking in front of a crowd, and then just getting completely anxious about that, which is common.
Yeah. Let's talk about some of the stories in the book. Katie, in particular, also spoke to me a little bit. I felt for her. Can you talk to us about Katie?
Well, Katie is again a teenager. I love seeing teenagers in my practice. I have for years. Because a lot is going on in those years. A lot of that's where a lot of when I take a history from adults, a lot of people. I talk every new patient I see. I got to tell me go back to the beginning. Talk about your childhood. Tell me about elementary school. Tell me about middle school. Tell me about high school. So I usually walk through from the beginning and see like when did things start. And it often, like I said before, a lot of things start in the teenage years, and so Katie basically developed anxiety and an anxiety disorder, and in her case, she was self-medicating. So she would go to parties and she would drink, she would take tranquilizers, and then in one party she actually almost passed out because she took too many. She had almost hit her head, and so this is a situation with her that, and this is based on a lot of the stories in the book are based on real patients I've seen.
Right.
Make some changes. There's not one story that's exactly one person. There's a compilation of different people in one story. But basically, this is someone who has an anxiety disorder that's self-medicating, like a lot of teenagers do. And then when she saw me, I recognized that, and I treated her, and she did very well with treatment. And then with her, it took medications, and what you don't do with someone like her is, oh, here's some Xanax or here's some Klonopin. You don't give people just a tranquilizer unless you're flying and say, here, this is your, this is your treatment. Just take this when you're anxious. No. So you got to go under the hood and really find out what's going on neurochemically. And then, so what medications are doing, like antidepressants and mood stabilizers is they're basically normalizing the person's body chemistry. So what I do is recognize that I think this is off. I think serotonin is out of balance. Probably norepinephrine is out of balance. And so I gave her Prestique because it balances those two chemicals. So what medications do, all they do is balance the person's own natural neurochemicals. And so that's why when they work, people say, I feel like my old self, or a teenager might say, I feel like I did in elementary school. I feel more carefree now, and I'm not worrying about things. I'm not stressing. So the same with adults. Adults will tell me, oh, I haven't felt this good in years. Well, yeah, because what the medications are doing is they're uncovering the real you. They're not masking things. They're normalizing your chemistry. So when you're normalizing chemistry, and the chemistry, remember, is out of balance for reasons the person has no control. So
a couple questions. Is there a danger to taking some medicines? For example, can you get addicted to it? Does it start to not be as effective over time? Next question after that. Is there a natural way to do this? Like, instead of maybe taking a pill, you go walk 5 miles a day. Like, is there a natural remedy that helps us? Because as you said, we all know these kinds of issues have been going on since the beginning of humankind, right? Yeah. So they didn't have pills. So what did they do? Did they go for a walk? So what are some of the potential dangers here? Can you get addicted to them? Do you need to change it and tweak it? And then on the other hand, are there natural remedies?
Yeah, but I mean, I think, can you get addicted to psychotropic medications? No. They're not addictive in any way. Well, now, again, the difference might be with tranquilizers or pain pills. Now, there are certain medications that people can get addicted to.
Right.
But not the medications that treat depression and anxiety, because they, and people might say, well, how am I not addicted? Because every time I try stopping them, I feel like I did before. Like, well, that's like telling a diabetic that I think you're addicted to your insulin. Why do you say that? Well, because every time you stop your insulin, your blood sugar shoots through the roof. Well, no, I'm just treating my disorder. So you would never say that to a woman who takes the thyroid supplement, that you're addicted to your thyroid, you're addicted to your insulin. No, you're addicted to your blood pressure medication. No, they're treating the condition. So I take this just as seriously. This is a medical problem we're dealing with. So now, do we have to tweak things if the effectiveness goes down? Sure. I'm always tweaking things. Do you tweak the med? Do you increase it? You decrease it? You add this? You do that? So yeah, no, addicted, no. The other thing that's common myth is that antidepressants cause increased suicidal risk. That's nonsense. So, and as far as natural treatments, yeah, there's natural treatments. And I think, there's over-the-counter supplements, but they don't work as well, to tell the truth. They're not balancing the chemistry. They're adding more chemicals that the body doesn't necessarily need, like St. John's wort and SAMe and GABA. There's things that can work for some people. But you mentioned exercise. Are there natural things? Absolutely. I mean, I talk to all my patients about exercising regularly, walking regularly. That's what I do every day. Every morning I walk. If you go to the gym, if you're into that kind of thing, I'm not. Eating right, learning how to relax, learning how to breathe. I mean, breathing is super important. When someone has anxiety, you got to learn how to breathe properly. And that's where you can take some yoga classes to learn that, or meditation classes. So that's kind of, but I think, as far as do people self-medicate a lot? Absolutely. And especially generations past, but not even that. Nowadays, people self-medicate a lot with alcohol and drugs, and so in unhealthy ways, they treat themselves.
I want to talk about a couple of common phrases that people throw around a lot. Oh, bipolar, you're crazy. What is bipolar? And isn't that the new term for manic depression? I mean, what is it? Right. And let's start with that. Then I also want to talk about narcissist personality, and also personality disorder, and a few of those.
Yeah. So bipolar basically is a big term. I have a whole chapter on that. This chapter 3 of my book, where I talk about, the first story is about someone who has bipolar 1 and has a more severe variation of bipolar disorder. And then the second one is a guy who has bipolar depression. So bipolar, you're right, is the new manic depressive. It's a very disorder. There's bipolar 1 disorder, the most recognized, which means mania. So when someone's manic, they're very elevated mood, they're very irrational, they're paranoid, they do risky behaviors, so that's mania. And then they eventually crash into depression often. There's hypomania, which is a lesser form of mania, not quite as irrational, but they don't sleep well. They get maybe 3 or 4 hours of sleep, and then but the majority of bipolar is actually depression. And you can, it's a more severe depression than what we call unipolar depression, which is the more common type of depression. So there's a lot of variety in bipolar between the really severe cases, bipolar 1, down to the bipolar, this depression. And so there's so much variety. It's often missed. And I'd say this in the book, that it usually takes the statistics are that it takes 3 to 4 doctors 7 to 10 years to diagnose bipolar disorder.
Wow.
And the reason for that is doctors are always looking for, well, the person's not manic, so they're not bipolar, or the person didn't end up in the hospital, which is usually what happens when you get really manic. Because you're out doing crazy things, and the police come and you get detained, and you end up in the psychiatric ward. But see, if it's not really super severe, then doctors don't take good histories often, so they don't ask about that, or they don't see that, or they oh, I'm depressed. Okay, well, they just label them as normal depression. So that's why it takes doctors a long time to figure it out. But the way you figure it out, and I, as I said in the stories in the book, is that the fact that antidepressants aren't working as well as they're supposed to, or they make the person worse, or they just don't get the complete result you would expect from easier to treat depression. So that there's a lot of clues about bipolar that doctors miss, but it's a little more challenging to treat. So you have to use a little bit more medications than the other people, but it's very satisfying for me to treat it because, people you can turn their lives around dramatically when you treat it correctly.
What about people coming into you and not being truthful about how they are, if you will? Maybe their family member is saying they're behaving in one way, but they don't see it, and they believe that they are behaving just perfectly fine. So how do you actually get to the root of what's going on if the person themselves isn't even really describing what's going on properly? Do you know what I mean?
That makes it tougher. In the situation, I love to hear from family members because what happens with some of these patients, that's probably a bipolar patient, more likely. And so, I saw a woman yesterday who her mom called me before she came in. And so say, hey, she's not going to tell you this, but blah 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 blah. So she told me some things and so I've seen that with parents or siblings of people that that they think aren't going to tell me the truth. It makes it more challenging because I have to kind of try to figure it out, and if people aren't open to me, it makes my job more difficult. But getting family involved, especially with more complex cases like bipolar patients. It's sure nice to have other people, other eyes that can really see what's going on and then tell me what the truth is.
Narcissism, borderline personality disorder, that's got to be really tough because the person who is the narcissist or has borderline personality has absolutely no idea that they are this way, nor will they ever admit to it, cop to it, any of the above. How do you even treat that? And is it true that you really can't?
It's very difficult. That's why I call this section the impossible disorders.
Yeah.
So it's the most difficult thing to treat because medications don't work for it. Now, it doesn't mean, and I say this in the book with the stories, it doesn't mean that medications can't help, because a lot of people who are narcissists or borderline, or we'll talk about sociopaths in a minute. That's even different. That's even worse. But you're right. They don't recognize, and then they don't see themselves, and you can't treat it very easily. Well, now with borderline personality, there's a type of therapy called DBT, dialectical behavioral therapy, That's the most specific therapy for borderline patients. Now, it's very involved. It's a very involved type of therapy. A lot of people don't want to do it because they don't think they have a problem. So it's the toughest because people don't admit it, and you can't treat personality. Medications don't treat that part. However, like I said, and I say in the book, medications take away the rough edges. They basically because with these personality disorders, you're going to see for bipolar disorder, you're going to see anxiety, you're going to see depression, you're going to see other things that can happen with it. And so medications can kind of take away the rough edges because you can at least treat part of it. But as far as the personality, they need either they understand whether they have it. And I have a patient who was borderline who's doing way better because she recognized it. She read about it. She read it was 3 books about it to understand herself. That's not typical. That's very typical. But she's doing great now, and she had some therapy, but she's totally normal now. No, because borderline people can be chaotic. They lead very chaotic lives. Now sociopaths are different, and psychopaths. These are people who have absolutely, they have really no regard for other people's feelings. They have no empathy. They can hurt someone and not even have a thought about, being empathetic. And then Martha Stout is a specialist in this. She's a psychologist. She wrote a book called The Sociopath Next Door. And she says, she says they have no soul. So it's a pretty heavy thing she says there. She said they have no soul. They're the toughest because they're evil. And the story in the book about Stevie, he's an evil guy and he does evil things. And so those people are very evil. They're the criminals. They're they're the really bad people. Narcissists are, like I said, more often men than women. They think they're the be all and the end all, and they think everyone should worship them, and they think they do no wrong. And they make the life hard for other people who have to deal with them, like spouses, especially. It's very difficult to deal with narcissists because they never claim to have any faults. They never say they're sorry. Or if they say it, they don't mean it. So the personality disorders are very different, very difficult to treat.
Yeah, and they're hard to spot, right? You're deep into a relationship with someone who has one of those, and oftentimes you're scratching your head saying, well, maybe it was me. Maybe I didn't do this right. Or if you're in an argument with someone and you say, I'd appreciate it if you apologize, and that person will just say, yeah, fine. And it's hard to spot. So what do you do if someone like that is in your immediate circle? Whether you work with them, they're in your family, what do you do? Run? But how do you run if they're in your life? How do you, on the receiving end, deal with that?
It's a really good question, and I wish there was an easy answer. But I think the best answer really is you try to get away from them. I talked to a woman yesterday who is divorced from her husband, who's is a narcissist. This is the psychologist that she sees told her he's definitely a narcissist. He's an attorney, and they're fighting on about child custody. But she had to get away. She basically enough was enough, and she just had to get away from the situation. And so basically you want to avoid them as much as you can. And you're right. If it's a family member or someone that's close to you, it's harder to do that. You just try to avoid them as much as possible. In the case of sociopaths, you get away from that person. You don't look back. That person is a bad person. You don't want that person in your life in any way, even if it's a family member. You excommunicate that person from your life. You don't need that. You don't need that person. You don't need a sociopath in your life to destroy it, because they love to do that. They love to destroy other people's lives. And so borderline people too, it's difficult because they're so chaotic and they create such chaos. So that's the best thing is either, if you have to put up with them, just try to do as little as you can.
And go get therapy yourself on how to deal with it, right? That's got to be important because there are sometimes people in our lives we just have to deal with it.
Right.
right? And then maybe you need that person needs therapy on, okay, how do I deal with this? How do I disconnect but remain, connected to this person in some way? I would imagine that that's important too, right? For your own survival.
And reading about it, like I said, reading books. There's some really good books on borderline. There's one called "I Hate You, Don't Leave Me," which is pretty descriptive. I
Yeah.
hate, or walking on eggshells. So people can read about books about narcissism and borderline. And like I said, if you're going to read a book on sociopathy, Martha Stout's book, "The Sociopath Next Door," I've read it twice. It's a fantastic book. She tells stories about sociopaths that you wouldn't think they are. They're not the criminals necessarily. They're not going to jail. They're not murderers and rapists. They're subtle people. They're the people who are the scamming artists, and they scam people money out of people, and so there's much more subtle types you really have to recognize because they're so charming, and that person could never be a sociopath, right? Not necessarily.
Now, we only have a few more minutes, but I just wanted, in that minute or so, to also just touch upon society disorders that you talk about, addiction, bullying, homelessness, and worse, right? Sometimes I can't even bring myself to say the words, right? Yeah. Very briefly, that's a problem for all of us, society disorders, right? Yeah. So wide open there. Go ahead.
Well, I mean, again, addiction, extremely common nowadays, self-medicating and underlying disorders. So people who struggle with addictions, they're treating their anxiety, their depression, their bipolar mania, so self-medicating, they need to be treated. The homeless population, mental illness and addiction, that's the majority of homeless. So you need to treat the addiction, you need to treat the mental illness. People, the suicide chapter, the woman, you got to treat it and stay treating it. In her case, unfortunately, she didn't want to treat it and she stopped treatment, and the end was not good there.
Very sad to read that. It broke my heart. It really, really did. Go ahead, doctor.
In school shooters, that it like just recently happened in Georgia. I mean, these are people who just are very disturbed. Obviously, these are sociopaths. Even as young as he was, these are people who obviously have no regard for life, and so it's very difficult. Are they treatable? Maybe if you can catch them early enough, but you have to identify and see maybe patterns where they're posting things, and if they have access to weapons. Like in his case, his father gave him an AR-15. That's not good. So yeah, so that's school shooters. It's heartbreaking. It's bullying is super common in so many levels in our society. A lot in school, a lot of adults, online. That bullying goes deep, and so everyone's affected by that. So
yeah. I mean, I go back to saying, if it's possible, in any way, in your home, in your community, on your block, to try and create that little community again. Because everybody sort of is looking out for one another, even just a little bit. There's this great little post that I saw about Italian grandmas, right? And it said, here's the FBI in some cultures, and they're out looking, right? They're over here and they're looking. And you've got the little old man, looking. In other words, we need that little village back where we're all sort of looking out for one another. We've gotten away from it, in the case of that school shooter, sadly, I think people were reporting him and his behavior, and the police went to his home and recognized that there could be an issue. But in the end, they said, well, we have no reason to not believe what you're telling us. And then they left. I think they did a really good job, the young boy and his dad, convincing everyone that, no, he's okay. Right. That's a tough one. You can't blame anyone there except it happened. Right. And he did a real good job snowing everyone, including his dad. And what a shame. Very, very serious issues. Doctor, how can people get in touch with you if they want to come and see you, want to talk with you? Do you also Zoom with people?
Yeah, I did that. I mean, a lot of telemedicine since COVID, especially. My phone number, my office, and I do see people remotely, 949-481-0118. My website, I has everything. The 4 books I have on sale. The drpaulcoronamd.com. It's a DR for doctor, so drpaulcoronamd.com. My website has a lot of information about me, my background, my books, which are being sold on Amazon, and my first 3 books are there too. And then I have a podcast, but I have some also exciting stuff coming up. My TV show is coming out soon. I have a TV show, the Dr. Paul Show, is coming out on Roku and Amazon Fire within the next week.
That's great.
And then I'm going to be I'm going to start a YouTube channel. I'm going to put my TV show on YouTube also.
I think that's great because you're going to reach more people, and the more people you can reach who feel like, they don't know where to go, where to turn. And sometimes if they, look you up in that way, they'll see themselves and say, oh, wow, I'm not alone. I think it's a big one to say, I'm not alone. And please, people, pick up the book. The book is a wealth of information, whether you feel like you're struggling, someone in your family is struggling. The Corona Protocol. Please pick that up. It's a terrific read. I particularly enjoyed reading about the personal stories that you put in there because, again, we all want to feel like, oh, I understand this. So her too, or him too. Anyway, Dr. Paul Corona, thank you very, very much for joining us. It was really a wealth of information. And again, please look up Dr. Paul Corona's website. Check out the book, his upcoming TV shows. There's many ways that you can contact him. Call the office too. We appreciate you joining Deborah Kobylt Live.